How to improve neck stability and what mistakes to avoid is the subject of this video. In this video, I'll talk about why neck stability even matters, the common mistake people make, how to build neck stability the right way, and finally, what lifestyle adjustments we need to make for better neck stability. So let's start. Why does neck stability even matter? It is so important for you to understand that your neck is holding your head and your hold is the house to your brain. In order for brain to function the best, it needs to be as balanced and as parallel, not parallel to the ground, but as parallel to the ground as possible. So the function of your neck is so crucial for that major requirement. So in order for us to stabilize our neck, we have to understand that this is not the function of just the front of the neck or just the back of the neck. In today's society, we overuse the front of our neck and we hardly ever address the back of the neck areas. So what ends up happening is instead of the deep neck flexors to assist us in flexion and more superficial ones to essentially stabilize the head in place, we have learned to push and shove our heads back instead of the back of our neck area muscles to pull the neck back and everything else to support that move. So that means that because we're not using parts of our neck in stability and we're overusing other parts to provide that stability, we are essentially creating more instability of the head over the neck, which is compromising a lot of major functions in our body. You will never see anyone walking around with a crooked neck. What you see is a neck that is trying to hold the head straight with the rest of the body to shift. So your lack of neck stability can lead to other issues down below as well. So now let's talk about some of the common mistakes that people make. A lot of times people stretch their neck, which I understand it makes them feel good, but the reality is stretching is just you're trying to loosen up what has been overworked. So the question you want to answer is, why is it overworked and how do I not overwork that area? So when you stretch, a lot of times people can stretch quite a bit. And there are some people with connective tissue disorder that when they stretch, they can actually overstretch their neck nerves and arteries, and that can come with complications. Another common mistake that people make is they crack their own neck. When you're cracking your neck, that's not the same thing as adjusting your neck. When you go to see a chiropractor to get your neck adjusted, they're looking for any fixation in the joints. So the areas that you can crack your neck, it sounds like cracking just like when you get your neck adjusted by a professional chiropractor with a licensed chiropractor. So the sound is the same. The good sensation comes as a result of something else, which I can explain to you shortly. But the reality of it is you are moving whatever moves to crack. So it's not the same thing. Another mistake that I see happening is when people use strengthening straps to strengthen their neck. Think about this for a moment. A newborn baby cannot hold their head up. After a couple months, no problem, they start holding their head up more and more. They don't stretch, they don't use any strengthening straps, right? So how do they strengthen their neck? Those are the type of exercises we need to use as our model to strengthen our body parts. Not a strap, not working against resistance of a strap, but holding our head, engaging the right place, right muscles, and keeping the head in place is the way to do it. So what I'm suggesting is looking into developmental exercises like dynamic neuromuscular stabilization. Those are developmental kinesiology exercises. Now let's go back and talk about that cracking, because I promised you I was going to do that. When you crack your neck, just like when you get adjusted by a chiropractor, you're working within a zone that's referred to as physiological zone. So here's my finger. I can bring my finger up by myself, but with the help of something else or someone else, in this case my other hand, I can go from this zone to this zone. That is the physiological zone. When you are within the physiological zone, the brain gets a signal that this is outside the normal performance. So it releases natural tranquilizers. It feels good because of that. But not everything that feels good is necessarily a good thing for you long term. So when you crack your neck, you're just moving something that you would barely touch and it would move. Have you noticed how you started cracking your neck? At the beginning it was hard to crack, but then it's just like you move your head and cracks. Now when you see a chiropractor, they're very strategically going there and doing very specific adjustments that's needed. That's not the same thing. So wanted to bring that to your attention. So now comes the next question. How to build neck stability the right way. So let's talk about that. Just like I mentioned to you before, to stabilize the neck, we don't use devices. You have everything you need. You just need to do it correctly. In my practice, I deal with a lot of patients with joint instability. I deal with patients with chronic issues. I deal with patients with pelvic floor dysfunction, which is instability of the pelvis. For every single one of them, I use developmental movements. Those are the same exercises that got us as a helpless infant to running toddlers without any gyms, no bands, no guidance whatsoever. That's because you're hardwired to do those exercises yourself. The ones that I really like that I use for with our patients for neck stability are things that we essentially have done as babies. So the first one is tummy time. We did tummy time between the ages of 6 weeks to 3 months. And that's gonna look like this. You're gonna be laying down on the floor with the crease of your elbows at your ear level. Placing your forehead down on the floor. I'm not gonna place my head down now because I want you to hear me, but the crease of your elbow is at your ear hole, and you're pressing the inside of your elbows onto the floor. Remember, you're only 6 weeks old, so this is not a death grip, and keep that in mind. As you simply gently press the inside of your elbows, you start feeling the shoulder blade shifting down your body like it should. You're breathing biologically. I've done videos on that. We'll make sure that at the end of this video, we will put what biological breathing looks like. You're gonna be on your forehead. And now you're gonna scrape your nose on the floor, go another inch, and hold it in place. That means the muscles that I have at the base of my head, who are in charge of my head moving over my neck, have done their job. So scrape, lift, and hold. Now the job of those muscles is to hold. I'm still pressing on the inside of my elbows, sending my shoulder blades down. Now the muscles of my neck, which originate about 6th rib about here, from that point are gonna have to practice gliding my neck up and hold. So I'm still pressing on the inside of my elbows, sending my shoulder blades south. My head muscles lifted my head. My neck muscles are holding my neck up. And now with that, I'm going to rotisserie my head. So I'm holding my head up towards the ceiling as I turn my neck towards the camera, still having that upward move towards the middle and the other side. This is what you did at age 3 months. This is the beginning, the birth of putting life in the back of your neck muscles. The next one is gliding your neck back. A lot of times I see people tucking their chin down and shoving it back. That is not the same thing. What you want to do is you want to bring your chin slightly up. This is not tense at all. And you glide your neck back. That's the same muscle you just learned to put life into during the tummy time. The next one is upping the game just a little bit. So we're going to go back on the tummy. This time you're in the late part of your 3 months of age. Imagine that. So in this exercise, you're going to have your hands under, your fingers under your shoulders. You are sending pressure from your upper trap down your arm to your elbow, and then from your elbow to this bone on the pinky side. So find that bone, that's called pisiform. So place your pisiform on the ground under your shoulders, upper trap to the elbow. So watch. Did you see how my upper trap is going towards my elbow and my elbow is going to that pisiform? I'm going to scrape my nose an inch up, glide my neck up. I already practiced that during the tummy time. And now I'm lifting up, holding it, and bringing it back. So let me do it again. Upper trap to the elbow, elbow to the pisiform, pressing like as if I'm trying to push myself down. Scrape the nose, an inch up, function of the back of my head muscles, gliding my neck up. That's the function of my neck muscles, pressing, holding. In this exercise, I'm learning to connect my neck to proper movement of my shoulder blades, proper movement of my mid-back. I'm teaching myself, creating neural pathway. These are all developmental kinesiology benefits. All of these are happening so they all learn to dance together. Movement is a symphony orchestra with a spotlight on different parts of your body while the background musicians are still playing their part. So you need to not forget that. The last part I want to talk to you about is the lifestyle adjustments that are important for neck stability. So let's see what they are. We want to make sure that if we're working with our devices, that the devices are in proper positioning. We're not looking down. We're looking at our screen, at the middle of the screen being about eye level, maybe a little bit higher. We are not trying to glide our neck forward, maybe increase the font size so you can see better. You get up every 30 minutes to an hour to make sure that you are relaxing those muscles. You are also playing the 20-20-20 rule. That means when you're looking at your screen for 20 minutes, you look away at something 20 feet away for 20 seconds. So 20-20-20. That will allow your eye muscles to relax, and your eyes and your neck play a big role in your neck positioning. You want to make sure that you are also paying attention to how you're sleeping. Sleeping on your stomach is not a good idea. You want to sleep on your side, you want to sleep on your back. using supportive pillows. I've done videos on that. If you have not subscribed to my channel, it's a great opportunity for you to subscribe now. Make sure you click that notification bell so when I post a video, it comes to you and you can review those things. I really rely heavily on you commenting and liking the video if you saw value in it, because this is how I get to share the knowledge with a lot more people, and that's what I ask you to do. Thank you for watching.